changing who we are as a specialty. And what's the remedy for this condition? A strong, powerful, shared vision that will allow us to capitalize on these changes in the future. There's never been a more important time for us to begin incorporating meaningful changes into our practice. The market forces and the technological changes that Ken and I have just touched the surface of are fundamentally changing the way periodontitis will be treated in the future. And hanging on to old and familiar ways may leave our practices out in the cold. The old adage, if it ain't broke, don't fix it, applies only if change is infrequent and incremental. But that's not the type of changes we're talking about. Slow, incremental improvements in your practice in the future will not be enough. Establishing a strong position and holding on to it, like we've done with the treatment of periodontitis in the past. It's like building a moat around the castle. Keep your moat repaired, the Army trained, and stay put. But staying put is a risky strategy in times of fundamental change. To me, trying to maintain the treatment of periodontitis as the focus and foundation of our specialty is much like driving down the road with the gas pedal floored and you can't get past 35 miles an hour. You look out the windows and your competitors seem to be passing you by with ease, while all the time you are running your vehicle into the ground just to keep up. Desperately, you search for answers. You stop at the next gas station. The mechanic tells you, hey, when you get to 25 miles an hour, you might consider changing into second gear. Such it is with incorporating changes in our practice. First gear, periodontitis, has served us well in the past, but it's likely to impede our future. And keeping this first gear mentality of our options for the future will yield limited results. The key to taking our practice and our profession to the next level is not pushing on a pedal that's already floored. The problem superficially seems to be the number of periodontal patients available for us to treat is declining, and the competition for these patients are increasing. But if you really look at what we're talking about, it's really more than that. There's a fundamental change going on in the way periodontitis is treated today and will be in the future. And simply going down to the exhibit hall after we finish this lecture and adopting a new technology into our practice, or determining that we're going to fight the competition, whoever you think the competition is, whether it's the general dentist, the other periodontists in this room, or industry, fighting the competition is unlikely to be very successful. Success in the future will not come to those practitioners or those professions that focus on the competition. Success will come to those that focus on the environment. Focusing on the competition when the environment is changing really is short-sighted. Now, I'm not saying the competition's not important, but it is your critical factor for success only when the game is not changing. The changes we've just talked about are very different from that. And focusing on the competition will likely blind you to the real challenge, and that's how do we capitalize on these changes. Competing for today's periodontal patients, to me, is just too much like fighting for deck chairs on the Titanic. It's time for us to move on. All operational paradigms have a shelf life. I don't care how good they are. Intel used to be in the memory business. Now they're in the microprocessor business. General dentistry used to be in the caries business. Now they're in the cosmetics business. Now it's time for us to refocus on who we are and what we do. We're somewhere in the later stages of stability. You know, we've made some mid-course corrections and all of us are doing pretty good. You know, that's good and that's bad, because it's hard for us to incorporate change when there's no visible crisis. I mean, most everybody in this audience has taken a week off without pay, flown cross-country, staying in one of the most expensive cities in the United States to attend this meeting. It takes urgency to get us to move forward, to move us out of our comfort zone, and to get us to begin experimenting with new things in our practice. But the time to begin experimenting with these things is before we start to hear that roar coming from downstream. The time to begin experimenting is when our practice is still strong. Now, if you're close to retirement, you may say, hey, I think I can just ride this out. But for the rest of us, the only question is, how much pain are we willing to endure before we start refocusing our practice? Now, intellectually, this is an easy thing. We want to move that intersection up there. We want to make these changes while we're strong. But while that's intellectually easy, it's emotionally difficult. Because when the environment renders some of our traditional skills less relevant, we tend to be like that little kid that doesn't like what he sees around him, closes his eyes and counts to 100 and hopes when he opens his eyes everything's going to be okay. We tend to do the same thing. We tend to rededicate ourselves to the traditional assumptions, beliefs. We decide we're going to work even harder than we've ever worked before and hope that it's all going to work out by the time we get to 100. But if we follow that course, where we're going to end up is right there. Now, it's up to us. We can stand in the shadows and we can let others control our future, or we can manage the changing world around us and we can follow our vision to the future of choice and not the future of chance. Last year in New Orleans, we unveiled the vision to the profession. But that didn't mean we just flip the switch and everybody moves from the old to the new. Change is often thought of as an on-off type switch. But change is an unfolding process, not a binary event. And for most of us, it's not the change that's difficult, it's the transitions. Change is situational. You move to a new office. Transition is psychological. You move to a new identity. And transition is not optional. It's not something that we can wait and do until all the important things have already been done. Those people that go through change without a transition, that's what they mean when they say, hey, just because everything's changed around here, don't think anything's different. And the reason change is difficult for many of us, transition's difficult for many of us, is because all transition begins with an ending. You can't move forward without leaving something behind, and oftentimes the very thing we're being asked to leave behind is the very thing that got us here in the first place, the thing that made us successful. And that's awful hard for any of us to do. But people stay in situations that they know are not working all the time, rather than to face the ambiguity of the unknown. We've got to accept that you're going to have to pay to get what you want, or you're going to pay and not get what you want. Change is expensive, and you're going to pay either way. And when the price of status quo or staying put is higher than the price of transition, then change is mandatory. But where does that put us? It puts us in that jungle Ken talked about, and that's an uncomfortable place to be. It's that psychological no man's land between our old reality and what we want to be. And a lot of us that are beginning this journey are in that place, and it's not too comfortable. It's kind of like the wilderness that Moses led his people through. You know, it took him 40 years to do that, right? Not because they were lost, but because a whole generation that had known Egypt had to die off before they could move into the Promised Land. Now, taken literally, that's kind of disturbing, that a whole generation of periodontists are going to have to die off before we move into our new vision. But on a less literal level, it is true that our operational paradigm of periodontitis as being the focus of our specialty is going to have to die before we can realize our vision. Now, Moses took care of the transitions ending when he took his people out of Egypt, but it took 40 more years to get Egypt out of his people. So it's not going to happen overnight. Hopefully it's not going to take us 40 years, but it takes a while to reorient and redefine yourself, and it can be uncomfortable. But you know what? It's also a time of great opportunity because we're not constrained by the old order. We have extraordinary opportunity and influence, personally and professionally, if we can gain a clear sense, a clear vision of where we're going, and that's exactly what the Academy's vision is trying to do. But you know what? The Academy's vision is the big picture from way up in space. And this is as far as the Academy goes in the journey. From this point forward, it's up to each and every one of you. Think of the vision as a template, and you've got to do two things. You have to establish now your own personal vision from this template, and you, and only you, can implement it. Yeah, you're in the jungle, but you're not alone. The vision's going to provide for us lots of guideposts, maps, and keys to the future. I mean, if you'll think of the vision as guidelines for the future, and you know how guidelines work, you're free to choose which guidelines that you want to incorporate. And so based on your own personal vision, all of us are going to take from the vision different guidelines, and we're going to create our own personal vision for our perfect periodontal practice in the future. And for even those of us who put together a similar vision, the way we choose to get there will probably be a little bit different, as it should be. But the important thing is that if you don't have that vision, it's unlikely you're ever going to get there. It's very, very important that we have this concrete vision. And also our vision influences our future. Our vision influences our actions today, and our actions today influence our future. So to create our personal vision, we have to think about, in your mind, what is your ideal periodontal practice in the future? What are your 5, 10, 20-year goals? What does success mean to you? Success is going to be different for all of us. For some people, it's more income for yourself, for your staff, more new patients, retaining existing patients, more respect from peers, better technical excellence. But if you don't spend a little time determining what success is, it's unlikely you'll find it. And as you formulate your vision, a vision must be defined, it must be written down, and it must be communicated. Your personal vision is not something you keep secret. You need to tell everybody. Tell your staff, tell your patients, tell your family. And after you've looked inside, now it's time to turn your attention to outside. What's out there that could be an opportunity, a springboard for your personal vision, or what's out there that could be a threat? Ken and I have just reviewed a number of these that the Vision's environmental scan identified. Yeah, some of them are kind of threatening because some of them say they're going to reduce or perhaps eliminate some of the things that you and I have depended on for a portion of our livelihood in the past. But to move forward, you've got to leave certain things behind. And the good news is that for every door that science and technology closes, it opens 2 or 3 more, creating an unprecedented time of opportunity for those of us who see the doors open and walk through it with the right knowledge, attitude, and skill. Now, our vision's going to make certain that our attention is focused in the direction of those doors as they open, but it's up to every one of you to make certain that you have the right knowledge, attitude, and skill to walk through those doors. And in order to do that, there's certain things you need to begin thinking about, formulating, and implementing in your practice today. You need to think about your practice mix. You know, the Academy conducts practice profile surveys every so often. We just completed one. Unfortunately, the results aren't quite out. But if you look at the most recent one, 93% of the respondents said that the main focus of their practice is basic general perio. Everything in our environmental scan suggests that will not lead to a robust practice in the future. Your beliefs about what procedures you're going to incorporate in your practice and your beliefs about what type of patients are going to accept those services are a driving force behind your success. And you know what? The good news is you get to choose your beliefs. Now, I want everybody to listen. I don't want any misunderstandings. Nobody walk out of this room and say that the American Academy of Periodontology is abandoning its heritage, that we're giving up the treatment of a periodontitis. Our vision states that we will continue to be the premier provider for treatment of adult periodontitis and periodontal diseases with systemic considerations. We're just saying there may not be enough of those patients to go around, and we need to broaden our focus. And it's hard for us to let go of that slight to moderate. But here's my suggestion to you. Let's celebrate our ending. Each one of you, go to your referral sources in your community. Tell them, you know what I've decided? I've decided that all of the non-surgical, or most of the non-surgical treatment for slight to moderate periodontitis patients should happen in your office. Probably are anyway, aren't they? And that you're willing to do whatever you can to help in that transition. Then take that as an opportunity to tell them about the focus of your practice. And as you begin to think about what focus it needs to be, make certain that you're incorporating a whole host of sophisticated surgical procedures. Advanced periodontal regenerative procedures, implants, major ridge augmentations, sinus grafts, extractions, ridge preservations. All of these things are very important because basic periodontal surgery will not be enough. We need to get rid of this practice limited to mentality. We need to constantly be expanding our scope of practice. I find it hard to believe that, I want these referrals for extractions. One of the reasons I went into periodontics was to save teeth. I still want to save teeth, but I want those referrals for extractions too, because they give me lots of opportunities. They give me opportunities for ridge augmentations, ridge preservations, to place implants, to diagnose periodontal disease on those patients that were referred for extractions, and probably to get referrals from offices who normally wouldn't send me referrals for periodontitis. And as we begin to incorporate more sophisticated surgical procedures, there's going to be a greater need for advanced pain and anxiety control. All of us, you individually and we as an academy, need to make certain that we are protecting our state's rights in our ability to be permitted in our state to administer advanced pain and anxiety control. I can tell you that the oral surgeons see this as a major state issue. They believe if they can control who is permitted for advanced pain and anxiety control, they will hold the keys to the kingdom. And they may be right, and we can't let that happen. And the way we're going to prevent that is all of you have to be involved. You've got to be involved in your local societies, your state dental societies, the American Dental Association. You better make sure that you have at least one periodontist on your state board of dental examiners. We cannot be successful in the future if we limit ourselves to this group. We must have influence outside our specialty. We also have to continue to be leaders in the implant world. Periodontists have led the way in the placement of implants for years, but periodontists may also need to be more directly involved in restorative dentistry in the future. For example, in our office, we now construct and deliver provisional restorations for some patients at implant placement or second stage surgery. Now, I haven't done a provisional restoration in around 30 years from when I was in dental school. Who would think that I might need to relearn this technique? But we all know the importance of the provisional restoration in controlling soft tissue contours, and if you think about it, it's just a natural extension of our oral plastic surgical procedures that we provide. It also allows us to deliver that patient back to the restorative office, so all they have to do is to take an impression. It's very important that we continue to try to move implant dentistry to its highest level while at the same time keeping it as simple as we can for our restorative colleagues. And with that type of approach, we routinely achieve this type of result. I mean, who says that implant dentistry can't be aesthetic as well as functional? Who among you can identify the first bicuspid as a restoration, much less an implant-supported restoration? We also need to make certain that all of us are involving all phases of oral plastic surgery in our practices. Very important, because it links us to the most rapidly growing segment in dentistry, cosmetics, and it links us to discretionary dentistry with all the benefits associated with it. I mean, it's really pretty amazing when you think about what we can do, from resolving the small blemish over the lateral incisor to completely reconstructing entire smiles.
The thing that bothers me the most is this gum. This is really low. My front left tooth, I believe, was the one that the gum line came real low, and then the right tooth, the gum line was real high. That's what caught my eye.
Dr. Michael McGuire moves the gum around each tooth to give his clients a structurally sound smile.
The gum is kind of like the frame around a picture. And you can have the most gorgeous picture, but if the frame is off, then it distorts everything.
Never underestimate the importance of oral plastic surgery to your practice or to the future of our profession. We also need to expand our horizons. Our vision states this in two different ways. It states that we need to support industry. And that's very important, that we need to incorporate meaningful technological advances into our practice. Otherwise, there'll be no incentive for industry to continue to support research in our specialty. And if that happens, we all lose. Industry, periodontics, and our patients. The reality is, periodontists have been slow to adapt innovations in the past. Our new vision statement says that while we will continue to be ever vigilant about the care and well-being of our patients, we will also be progressive enough to embrace worthwhile new technology. Our vision also states that we're going to expand into emerging fields of therapy. You know, a few years ago, scientists